Asthma is the most common chronic inflammatory lung disease. It is caused by inflammation of the airways that occurs throughout the bronchial tree. Most asthmatics have allergic asthma, which is caused by an abnormal allergic reaction to environmental substances such as dust mites or exposure to cats or pollens. Asthma can be episodic in its symptoms. People have wheezing, chest tightness, cough, and shortness of breath when the disease is very active. And in between these periods of high activity or flaring, patients can be relatively asymptomatic. During those times, there is still inflammation of the lungs and the airways, so the condition never goes away and is considered a chronic inflammatory disease. Primary risk factors have to do with hereditary factors, obesity, certain types of occupational exposures. The primary approach to preventing asthma symptoms is avoidance of those factors that trigger the disease. Reduction of exposure to allergens in the home, such as pets, dust mites, and other types of allergens. The primary treatment for asthma is inhaled medications. This includes short-acting bronchodilators. If that fails to work, we usually add on a chronic inhaled anti-inflammatory medication in the form of an inhaled steroid. If these medications don't work, we also add on long-acting bronchodilators, and in the most severe patients, we use biologic therapies. These therapies, which have been available for about 10 years, are probably the future of asthma management because they are very targeted, their toxicity is low, and they're extremely effective at reducing exacerbations and controlling the disease. We've had patients who, after coming to our center, go from being severely debilitated to having highly active lives. One of the most striking examples of this was an Olympic athlete that we saw who was unable to compete in her sport because of severe trouble with her asthma. And after we worked with her to manage her disease, she was able to compete in the Olympics. Dr. Geoffrey Chupp, director of the Centers for Asthma and Airway Disease at Yale Medicine.